Welcome back. You're still watching KTN Prime, and we just want to take a look at one of the stories we had lined up for you today, where Kenyans are seeking medical care abroad and are paying out of pocket and won't be reimbursed despite contributing to SHA until a system is put in place linking the authority to foreign hospitals. Meanwhile, SHA CEO Mercy Mwangangi has denied losing 11 billion shillings to fraudulent claims over 6 months, arguing the fraud was detected early and no money left their accounts. Grace Nganga reports.
Kenyans living or seeking medical services abroad who have been forced to pay their own medical bills despite making mandatory monthly contributions to the Social Health Authority SHA will not be reimbursed.
Right now we have no contracts with any hospital for any management or any treatment in India or in other countries. And so according to the law, SHA cannot pay for those claims because the contract has not been entered into. So those bills would have to be met by the Kenyans who have gone abroad to seek that care.
It is very unfair for those patients who faithfully pay their share, and it is just bad timing that they fell sick.
Can you move very fast and procure those hospitals? Comply with the law.
Appearing before the Public Investments Committee on Social Services, Administration and Agriculture, chaired by Navajo Member of Parliament Emmanuel Wangwe, SHA officials confirmed the authority owes 146 million shillings to hospitals abroad. The pending bills have disrupted services, leaving Kenyans contributors overseas unable to access treatment under the scheme.
In the new SHA Act, a different process was introduced of contracting hospitals for overseas treatment. It includes getting into contractual engagement with those hospitals, but also having the hospitals have a local agent within the country, a facility, for the purposes of referral of the client.
Meanwhile, the authority is working to introduce a new overseas medical package capped at 500,000 shillings by the end of the month.
When we finish the evaluation process, which will be complete at the end of this month, we will advertise and make public the facilities that SHA has contracted across the globe. It will include facilities in India, facilities in Turkey, facilities all across the globe. Those are the facilities that Kenyans should go to. If a Kenyan goes to any other facility, SHA will not be able to meet that commitment because we have to get into that contractual obligation.
Mwangangi's team was also put on the spot over reports alleging that 11 billion shillings had been lost at the authority, as she dismissed the claim, stating that the money in question was never paid out.
10.6 billion. Do we have the list to know who they are?
Thank you, Chair. Just to clarify, this 10.6 billion, now 11 billion, was rejected. And so it's not money that we have lost as a country. It's claims that SHA has been able to reject. And this rejection was supported by the system, as well as claim verification by our Claims Management Office. And so, yes, this refers to that as well. But we are able to provide you that list. We can bring that submission to you.
Further, it has emerged that the authority awarded a 2.8 billion shillings tender without tools and documentation to verify the validity of the said contract, raising questions over value for money.
2.8 billion. So whether it was manually done or not, how do you issue a contract of that worth and you don't look at the documents very well?
We didn't have a system to know whether they are up to date or no. For you to give a tender, for you to qualify as AGPO, the certificate must be available first. So the subsequent theories, we should not entertain them.
The committee also heard that pending bills inherited from the defunct NHIF now stands at 33 billion shillings, further piling pressure on the new health insurance scheme. SHA officials told MPs that additional budget allocation will be required to clear both local and foreign arrears. Grace Nganga, KTN.
And well, with that story, we now move on to our